Welcome to Greenable Woodbridge. I am your host, Carolyn Ehrlich. Today we're going to be talking about mental health. Health is, sustainability is not just the environment. How we take care of ourselves is also in part, because if we're not healthy, there is no sustainability. We are a key part of sustainability. So it's not just about using plastic bags, it's about taking care of ourselves as well as the environment. So now, fortunately, mental health is being recognized as a disease and a health issue as much as physical health. And so to help us understand that, we have two guests from the Department of Health here in Woodbridge. We have Bonnie Nolan, who is the Director of Addiction Services, and Anthony Ruffino, who is the Mental Health Project Manager. And together, they helped us revamp how we respond to people who are in mental health crisis and how we follow up after they've had a crisis and how people can get help before they get the crisis. So, Bonnie, do you want to give us a little background on how we started and why we started to look at how we were dealing with mental health?
Sure, absolutely. Mental health was traditionally, unfortunately, something that was first responded to by police. Police are not equipped to handle mental health issues. They certainly felt they felt empathy for people, but they were not able to provide resources. If the person was not a danger to themselves or others, and they weren't taken to the hospital, then there really wasn't much more that the police could do. They were unhappy with this situation. Residents were unhappy with the situation. Residents began to be angry in some cases because police were not able to do more. The current Woodbridge administration realized that this was a problem, recognized that we needed to do something more. And so we in Addiction Services were kind of a natural liaison. We are already responding 24/7 to mental health issues in the form of substance use issues. So because we're out on call 24 hours, this was sort of a natural fit for us to begin to respond to people who were having a mental health crisis. So what we were doing is we would just find out that there had been a call. We did a lot of research to discover what resources were available to people for free of charge so that they could get help. We had coaches get in touch with people when it was appropriate. We also referred people to a county agency called Specialized Case Management and Outreach Services. This is sort of a central clearinghouse where they help people find appropriate services. So treatment, yes, it's outpatient, inpatient, any kind of mental health treatment, therapy, again, free of charge when appropriate. And also, they could do ancillary services, like helping people sign up for health insurance or find housing even some, there are some temporary respite places where people can go where they have mental health peers. So there are already many services available in the county. People just needed to be connected to those services. So that's kind of what we started to do. We got way more mental health calls than we anticipated. The police let us know.
Especially now after COVID.
Oh my goodness, the police let us know there would be a lot. I had no idea. Mm-hmm. But we did, we respond to well over 50 to 100 calls in a month. Wow. Yeah, quite a few mental health calls.
It's actually sad.
It's very sad. But the good news is it's beginning to go down a little bit because people who are having mental health calls are now getting a response and they're getting connected to services, peer services. They're learning to take their medications from peers. But the problem was we were encountering a problem because we didn't have like a really clear way to sort of graph what was happening, how many repeat callers we had, whether people were getting services, getting connected. We just didn't have a really good data mining system. Mm-hmm. And that's where Anthony comes in.
Yes, exactly.
Yes, you created an amazing program, I hear.
Well, I like to think so. So what we ended up doing was essentially I created a form and the police get that form. The form is about 1 to 2 minutes that it takes to fill out, and then that form gets sent directly to Dr. Nolan and her team. So they review it and then they can say, oh, well, this is the issue, whether it be bipolar disorder or suicide ideation, things like that. Dr. Nolan's team can get that person to the appropriate agency, as a referral, right? Because we want to make sure that they get those services, and we can't really do much to stop the initial phone call, but what we're trying to do is eliminate the second phone call. That's what's really important, because, really at the end of the day, mental health is a systemic issue at the federal level, right? It needs to be addressed at the national level. So there's nothing we can really do to stop it ahead of time, but it's a good start.
Right. That's fantastic.
Yeah, we're trying.
It's we're miles ahead of where we were just a couple of years ago, actually. And so the police, though, they're still part of it. They're still going out there. They're still the first responders. They get there faster. But I understand they've had some training. How does that work?
Yeah, so there already was a crisis intervention training, which is an excellent training. I've been through the training. It's really very comprehensive. It's a 5-day, 40-hour training that many officers go through. A very high percentage of Woodbridge officers already attend this training. There's a lot of support in the Woodbridge PD for this training. However, it's not practical to send every single officer, and when you're on a call, as officers expressed to me, you don't always know that it's going to be a mental health call until you get there. So it's important that everyone has some training, at least basic training in being empathetic, in handling a crisis appropriately so that you don't make it worse. So they're already trained in de-escalation, but there needs to be some training that helps them more specifically handle these types of mental health crises. So together with the Middlesex County Prosecutor's Office, we were able to develop a truncated version of the crisis intervention training. So now there's a 2-hour training that officers can take in the interim. All Woodbridge Police Department officers take the training in the interim. They take this training so that they have a basic understanding of mental health issues. They can tell the difference between a mental health issue and a developmental disability, which is something that not everyone can do. So whether this is something that's actually a mental illness or if this is something that somebody was born with and this will continue to be an issue. These kinds of things are really important for officers to understand. And it just helps them with their level of empathy and compassion. Officers know they can't arrest their way out of a mental health crisis, and they're not interested in doing that, but this gives them a little bit more of more tools so that they can actually do something to help them.
That's terrific. And to be able to recognize the differences when they go on these calls has to be so important.
Yes, very helpful. I mean, without this training, they really don't have any idea, and they're charged with protecting the public. So, unless they have this training, they're going to err on the side of caution, and that may be detrimental to the person they're dealing with. So it's helpful for them to have a little bit more understanding of what they're dealing with. All of the officers that have taken the training are appreciative of that.
That is great.
And it's detrimental to the workload as well, because the problem is, like I said before, with the repeat phone calls, the police officers are almost always the first responders out there. So they get that first call, and then hopefully they can get that resource through Dr. Nolan's program, and then we can end up getting that that police officer, free from going to the second or third time, or the fourth or the fifth time, because then we attach that person to a resource that they could use.
Which is the main thing.
Right, exactly.
So, and also, when we say that the police are the first responders, I think it's important for our listeners to understand that whether it's a first aid call or a fire call, they're in their cars, and they usually get to any emergency situation first. It's not because we want the police to necessarily deal with a fire or first aid, but they're there and they can assess the situation.
Absolutely. Just has been the case with Narcan. They are the first responders. They are most often the people who administer Narcan when there's an overdose. So yes, they are the first responder to pretty much any emergency.
Right. So let's take a minute just to talk about the Narcan project. When we talked about that years ago when it first started, and we were kind of new in the field. And now the success that you're having as far as the individuals are and the other towns that have joined you. So let's talk about that for a minute.
Thank you. That's a very exciting program. Yes, in 2016, the mayor essentially sadly was tired of going to wakes for young people, and recognized, apparently way ahead of a lot of other mayors in the state, that we are having an opioid crisis. Since then, the opioid crisis sort of went down a little bit, especially in Woodbridge. We sort of enjoyed a brief little reprieve. People were still dying, unfortunately, but at a lower rate. COVID hit, and also at the same time fentanyl hit. So
Right.
fentanyl has been a big culprit. It isn't that we're having more people die, it's just that it's sort of happening suddenly. We're not seeing the downturn that we were seeing in 2018. It's sort of holding steady despite our best efforts. So we are managing to help a lot of people enter recovery through the court program and through the hospital program, through community outreach. It's just been overwhelming how many people have responded and positively, and just every day we hear success stories and get encouraged.
Beautiful.
Yes, but fentanyl's out there. Anyone who is struggling to enter recovery, now is the time, for sure. It's very, fentanyl is not just in opioids, but now it's found its way into cocaine, so recreational users of cocaine are coming up, positive and overdosing on an opioid that they have no experience with.
And the dosing is horrific too. There's a very, very small amount, which issues what's the term? A lethal dose.
Yes.
Yeah, very small amount can be a lethal amount.
That's scary.
Yes, very.
It's very, very scary. One of the good things, just like where mental health is now not something you have to be ashamed of
That's
if you
right.
have an issue. Addiction and the people and their families, it's no longer something that you have to hide and not talk about.
Yes.
And a lot of that is what the Department of Health is doing with the publicity. And as you said earlier before we went on the air, addiction is a part of mental health.
Oh, yes.
So-
Yes, and we're having a mental health crisis, and this is a public health crisis. So between opioid and suicide deaths, as well as mental health crises, this is a public health
Right.
crisis. So
Most of my shows are not downers, but but this is a really, really serious issue. And I got to tell you, I don't think there's a family that's not impacted by addiction or other mental health issues anywhere.
yes,
Because and now it's coming out more in the open, and the statistics of the impact that COVID had on people's mental health is amazing. And I think for years to come, there'll be more studies that talk about it. I have my unofficial theory is that families being close together actually bonded and got stronger, and then there were the families that went, get me out of here, I
Yes.
can't deal with this.
The being
agree.
locked in, being unable to work, those two things alone would be
Right.
detrimental to your mental health,
Yeah.
And putting, tooting our own horn, I guess you could say, is, with this program, we're able to try to link those people to the resources that they want, because a lot of people who have mental health issues, they're unwilling to go and get help for those things. So that's a little bit different with us, because we're reaching out to them. Of course, there's already been an incident, but of course, after that incident, there's no guarantee that they're going to reach out to anyone. With this program, we can try to do that, to reach out to them instead.
Do you find that when they've come to you and now you're referring them to the services, that their family is supportive and helps them to get there, or is it kind of you're on your own thing?
No, every case is different, of course, but we have found that overwhelmingly the family wants the person who's struggling to get help. Mental health is a family issue.
Right.
So we do find that families, especially in situations where parents are involved, we find that they really, I guess with everyone, they find that they recognize that if their loved one is able to get better, their family will get better. And they're often very open to helping. And a lot of this information is brand new to them. So you were talking about being a downer before. I see this as a silver
good.
lining. Yeah, I mean,
That's right.
because it's a little bit of a darkness before the dawn. With the opioid crisis, it had to get to the point where everyone was affected before we recognized, okay, this is a brain disease. We need to stop judging people. We need to help people get the help they need. And I think it's really the same with mental health. If enough people begin to speak up and say, okay, our family is affected by this, people will understand it's a brain issue. Your brain's part of your body. It's a
Right.
health issue, and there is help available. There's a lot of help available.
Exactly. The medications that they have now for mental illness,
Yes.
it's amazing.
Amazing.
In some ways, it's just a balance.
That's right.
You got to try different medicines until you get that balance.
Right, and with family support, it's important to realize also that you need political support, elected officials, and it's nice having that in Woodbridge, because there's a leadership team who's willing to say, hey, this is an issue, we need to address it, and then giving us the ability to do so.
Right. And you have.
Yeah, right,
You've been
exactly.
very, very successful.
Yeah.
Yes.
So how many calls do you get in an evening?
So in an evening,
Or a day in an evening?
the way that it's reported to us right now, Dr. Nolan, I think that we're getting maybe 4 or 5 every couple days, right?
Yeah. I would say it probably works out to about 10 to 15 a week. And it really just varies. There are some nights where we'll get 3, and then we'll go a string of days with none, and then we'll have 3 more.
The worst that I saw when I was just running the basic statistics, December 2021, I think we had between 50 and 70 calls in 1 month period. Of course, that's associated with the holidays, right? And of course, it's colder out. I'm not an epidemiologist, so I can't say for sure, but there's definitely something corollary to those 2 ideas that increase the number of mental health calls.
Right, right.
Yeah, but 50 to 70, I forget the exact number, but about 60, that's a lot. That's 2 a day.
Lot.
Right.
And when you think that the police are going out on those calls,
Yes.
that's keeping them pretty busy.
It's a lot of manpower.
Yes.
Not to say that it's being wasted, but it's a lot of duplicate manpower. How many of those calls were repeats? I haven't done that math yet, but I'm sure more than just a few.
Right. Yeah. No, you haven't had time to really
very busy.
dig into it.
Yeah.
Wow. So it is very scary. And so if a person, before they get to crisis, a person or the family realizes we need help here, what can they do?
Well, we've done a lot of research now in the health department. So honestly, the most expedient way to find out what kind of resources are available would be to call our office. And that would be the quickest way in Woodbridge, to call 855-0600 extension 5008 or 502. Maybe you'll have these posted, 5020. And we can give you the resources that are available. We do have a one-page sheet of resources that are available, but we can speak with people and actually kind of help them find the type of help that they're looking for. As I said, specialized case management and outreach services is a service that's available in the county. Families can call them directly and find out what services are available. That's run by Rutgers University. But again, a county provider. So they are able to, as I said, find any services that someone might need, let people know what services they could get free of charge, and additional services like peer services, which are so important and so effective. So peer services
Can
are,
you explain what
of
the peer
course,
services are?
just like with substance use, peers are people who have walked the walk. They're people who, mental health peers are people who struggle with mental illness themselves. They're in remission or recovery from some sort of mental health issue. Maybe they take medication. Their situation is well managed. They've been through the services. In many cases, they've been through the judicial system. They sort of understand what happens to people who have mental health issues, and they want to give back. They provide services like just helping people find social outlets, helping people manage their medication, find treatment, find community meetings. There are meetings for people who struggle with bipolar disorder or depression. There are all kinds of support meetings and things that are available, and peers are very helpful in helping people find these outlets.
Do you find that people quickly, do you have any problems getting people to be peers?
No, I don't think so. I think that there's enough people who are interested in helping those who haven't yet been in their shoes, right? So, as someone who's a peer leader, right, they have been there. They know what it's like. For them to step up and help those other people, it's gratifying. It gives them some kind of self-worth, right? And me personally, I'm blessed. I haven't been I never really struggled with mental health. I'm good with science, the maths, the things like that. So I'm helping in my own way with this referral program, right?
You
So
definitely have helped.
trying.
Yeah,
Absolutely.
that's really
So yeah,
good.
it's having people who are willing to help. It's important. And I don't think it's hard to find those people.
No, that's great. Just like with the addiction services.
Yes,
So-
yes.
and
Lots of
that-
people that want to help.
Yeah, it's beautiful.
It is. It really is. And it's helpful to the peers. You know,
Yes.
that one of the healthiest things you can do, one of the best, the one thing that works for depression or mental health that helps across the board, no matter what, better than any antidepressant, better than anything else, is to help someone else.
Yes.
That's what helps more than anything, and that's evidence-based. I'm not just saying that. That's,
Right.
all data show that that's the case. Getting outside of yourself and helping someone else is the best sort of mood relief there is. So people recognize that.
People without even mental issues, it's
Right.
always The giving
Absolutely.
is better than the taking.
That's what got me into food safety, right? I want to be able to help people because my day-to-day job, I'm a health inspector.
Right.
The idea of helping other people, even in a way that they don't realize or recognize, it means a lot to me. I know that I'm doing the right thing.
That's right.
Yeah.
That's great. The health department overall,
We do a lot of different things.
you're doing amazing things there. People don't realize it's, up until COVID, it was kind of like our quiet department.
Yeah.
You
Because
did
that's
these
because
kind of
things are working. That's
Right.
why it's quiet. Because
That's
things
right.
are working.
and you dealt with COVID.
Yeah.
Unbelievable.
Thank you.
So many clinics, and my favorite, we're going all off topic now, but
Yeah, right.
my favorite part was when the children were able to start getting the vaccinations, and you dressed up as
Our nursing division, I don't want to do too much of an aside, our nursing division is fantastic. They did different themes. They did a Disney theme. They did different superheroes, all these different things, really getting the kids through the door. I think we've done over 15,000 vaccinations.
wow.
I know.
And the kids had a blast.
Yeah, they
It's
did.
just so
It's
fun.
beautiful. It's like, can I go get another vaccine?
A couple crying kids, but still.
Yeah.
Not
yeah.
many. Yeah. Yeah, it really was great.
So going back, do other towns use the referral program?
Well, this actually, this is a pilot program in Woodbridge. We kind of started it from scratch here, just trying to figure out how we could make things work together. But once it started to work so well in Woodbridge, we did want to reach out and find another town. Anthony suggested we find other towns to get
Right,
started.
exactly. So we reached out to Saraville. Saraville was more than happy to jump on board.
good.
Chief Zabrowski was very interested in the program. So we went to, for not just the Woodbridge Police Department, but also for the Saraville Police Department, we went to all of their prior to shift musters. So we really got hands-on with each and every one of their police officers. So that was,
way to
and
do
that was
it.
interesting to me because I really don't, I've never really been in the police department, right? I don't know how they operate. So it was nice seeing how they get briefed on their day-to-day and being part of that briefing. So it was interesting. We got to go there about 5 times a day for 3 days at each police department, really getting everyone on board, you know?
And I'm sure the reception, everybody was...
Yeah, I think so. Overwhelmingly, it was interesting to them because what's the harm? We're giving you what, maybe an extra minute or two of work, but this could pay off great dividends.
Exactly, and it has.
Yeah, exactly.
We have
So
the
I don't,
proof of that.
Right. I don't mean to downplay it. I just mean
Yeah.
when you're pitching the idea, you know, you can't really. Everything's 2020 in retrospect, right? We don't know what's going on right now. At the moment that I was going to the prior to shift musters.
That's great.
Yeah.
And so the response to this from the public, I'm sure, has been great. Do you get a lot of good feedback?
Yes, we get a lot. No, so first of all, the police are very happy to have something. I mean, ultimately, they got into this job because they wanted to help people
Right.
too. So it's very frustrating to leave a scene without being able to offer resources. So they're very happy to have this option. But we've heard from so many families that are just incredulous. Like, really, this is a program that the town just devised to help people with mental illness. Well, you know, what's it going to cost us? Well, we're here already,
Well,
so
yeah, so we're doing it.
we're doing it.
doing
It's
it.
fine. And yeah, people are really, really responding beautifully to it. You know, we haven't reached everyone. Some people are still shy about calling back the caseworker when they get a call. A lot of people struggle with, okay, this is something I'm going to be dealing with for a long time. Maybe I should get help. Maybe they need to see a few more incidents before they are really willing to get help. But a lot of people do respond to that first call and say, okay, yeah, I could use help. It's not going to cost me an arm and a leg. Okay.
Yeah.
Okay, I'll take it.
And at the end of the day, you always want to feel better.
Absolutely.
Yeah.
That's
So for physical health, we know the things that we should be doing.
Yes.
We should eat well, we should sleep well, we should exercise in some form. What can you do as the preventative measure, so to speak, for mental health?
Thank you. Anthony and I both have things to say about this, I'm sure, but all of the things that you mentioned for physical health happen to be great for mental health. So exercise is so important because exercise helps you sleep better. Eating regular meals is helpful. So making time to take care of yourself, prep your meals, not just eating on the go and scarfing things down. Also watch, the average person needs to kind of keep an eye on how much alcohol they're drinking. Alcohol really interferes. If you already have a mental health issue, it can exacerbate it, but it can also bring on a mental health issue. So you can start to have trouble sleeping, which can start to lead to anxiety, which can start to lead to depression. So it all can sort of begin with just a little bit more alcohol than you're used to, and a lot of people did that during COVID, drank a lot more alcohol alcohol than they were accustomed to. So we're seeing a lot of people who were fine before COVID alcohol-wise, and now they're struggling with an issue. And they'll get back on track, but it's important to recognize if that's happening. Don't drink yourself to sleep every night. It's not good for your mental health.
And your mental health can really be negatively affected by your stress levels as well. So if you're working too much, if you're drinking too much, right? That just for one example, working too much has stress effects on your body. It raises your cortisol, and then that has an effect on your body. And then if your body's not in good shape, there's a good chance that your mind is not in good shape either, right? So stress in general is just not good for you. I want to double down on what Dr. Nolan said. Exercise, exercise, exercise. It's really helpful. It makes you feel good. And then something that works for me is helping other people. There's something gratifying to that.
Yes.
Yeah.
There is one more point about exercise, if I can interrupt. It's
Please.
great. It's a great thing to do. Exercise outdoors if you can. Very helpful. Yes, that just 10 minutes of UV light has been shown to really positively influence mental health. So even if you can just get outside for a quick
little
walk.
walk. People don't understand that exercise does not have to be lifting weights.
No.
It can just be a nice walk outside.
Yes, and
that's
that
just
little
as
bit of
good.
sunlight is really good for your mental health.
Right. So you each have about 1 more minute if you want to sum up the issue.
I love what you said about people just want to feel better. That's really what I'm here for. I mean, ultimately with addiction, with behavioral health issues, all of it, people are suffering. People are struggling. They're not handing out medals for suffering and struggling. Come get help. Please, come get help. There is help available. So many people have done it. So many people are in remission from mental health issues, whether it's depression, anxiety, bipolar disorder, bipolar issues, or substance issues. People are getting better, and just call. It's confidential. We want to help you. We want to talk to you. We're not going to make you feel bad. We're not going to judge you.
That's beautiful. And Anthony?
You have to make that first phone call to us, right? If you don't reach out, just to build upon that, you have to reach out. We won't be able to solve it overnight, right? These things take time to fix, but by not reaching out, you're still at square one, right?
Beautiful. Perfect. This has been a very informative and important show, and I hope everybody watches it. We'll put your number on the air, and thank you so much, and thank you for everything that you do. Your work is so very, very important.
Thank you.
Thank you.
Thank you for watching Greenable Woodbridge and being part of the excitement and part of the change.